Welcome to Muscle Research Review for the week of May the 25th, 2015. Quick research summaries for the very busy health and fitness professional. So let's begin. Do you assess leg length discrepancy in your low back pain patients? Now, this has been a divided topic among many health and fitness professionals. Some studies found it to be related, while most kind of question its validity. Now, a new study looked at a population of 114 meat cutters that mostly stood and 34 customer service workers that mostly sat. Now, 49% of the meat cutters and 44% of customer service workers had a leg length discrepancy of at least 6 millimeters. The study found that the leg length discrepancy was associated with intensity of low back pain and self-reported days with low back pain during the previous year in meat cutters engaged in the standing work. Now, putting it into practice, the sample size of the study was relatively small. However, leg length discrepancy may be something to look at for those that primarily stand, with a leg length discrepancy of 6 millimeters or greater being the threshold. Future studies should be looking at the role of various working positions, in addition to whether correcting the leg length discrepancy will actually reduce low back pain. In my experience, assessing and treating muscles and joints in the neck for migraine sufferers has often led to pain relief. Now, a new study shows one of the reasons why. 30 migraine sufferers were compared to 30 controls. Pressure point threshold and sensitivity was assessed in all cervical muscles. The study found that migraine sufferers had lower pain pressure thresholds than controls in all the muscles. Now, these muscles include the upper trapezius, sternocleidomastoid, levator scapulae, anterior scalene muscles, and the suboccipitals. I've always thought that the pain from migraines may not all be due to the migraine itself. Now, tension headaches and cervical dysfunctions can also arise, which may be contributing to some portion of the migraine pain. Now, what are your thoughts on this? If you're seeing patients or clients that have undergone surgical repair of the rotator cuff, do you incorporate early or delayed active range of motion exercises? Now, a new study did a systematic review and meta-analysis to see if either affects rotator cuff healing. The study looked at 37 studies with a total of 2,251 repairs. Early range of motion was for those with less than 6 weeks after surgery, and delayed range of motion was for those greater than 6 weeks after surgery. The study found that early active range of motion was actually associated with increased risk of a structural defect for small and larger rotator cuff tears. So it may be advisable to actually wait 6 weeks. Now, we've all heard about sitting disease by now and its various effects on health. However, for association between inactivity and low back pain is conflicting in several systematic reviews. That's why the results of a new study are pretty interesting. They looked at 72 community-based volunteers and found that inactivity was associated with narrower intervertebral discs, high fat content of the multifidus, and high intensity low back pain and disability in a dose-dependent manner. Interestingly enough, there is no correlation between activity and cross-sectional area of the multifidus and erector spinae. However, we can't really determine the cause and effect nature of these associations. Definitely interested in future studies on this. If you have any comments, leave them below. Also, make sure you subscribe to our YouTube channel for the latest muscle research findings. See you guys next time.